Hi, this is an instructional video for strengthening of the lower limbs, specifically in knee injuries, but a general lower limb strengthening program. This one will include a balance or proprioception part. Exercise 1, using elastics around my feet, and we like you to do this with shoes on. Up on tippy toes, walking forwards and backwards for 2 minutes. Notice when I'm doing this, I'm lifting the feet off the floor, like so. I'm taking quite big steps. Don't keep the knees straight. Keep them bent. Notice my feet are a distance apart and my toes are not facing out, but straight forwards. And then finally, make sure they're a good distance apart, not too close together. So distance apart, facing forward, and lift the feet up. Notice here what I do with my trunk. There's good trunk rotation. You don't see me oompa-doompering like that. It'll hurt the back. 2 minutes. 2 minutes sideways walking on tippy toes. Feet a distance apart, facing straight forward. Notice here, not facing out, but forward again. I'm not bringing them close together, but I'm keeping them a distance. 2 minutes. Sideways lift. 2 minutes. With this one, it's 100 repetitions on both the left and the right. Hips, shoulders, knees, all in alignment, like so. You can see, and you'll feel this underneath. 100 reps, and other side, 100 reps. You may only be able to do 25 in a row, but 100 in total. Lying on your back. Just be careful with this exercise. You shouldn't do it if you have a history of lower back pain and it's lifting up and down. So any history of lower back, omit this exercise for the hamstring, and that will be 100 reps, both left and right. Single leg calf raises. Over here, standing on your bad leg, on a step, a set of calf raises with the knee completely straight, right up onto full point, meaning go right up onto the toe, not halfway, but right into full toe. And you'll go through and do a set to failure. A failure meaning as many as you can do in one go. The first session in the clinic, just do this one set to failure on both sides. When you do this in subsequent exercise programs, 2 sets to failure on both sides. The leg press is this machine, and we get you to use a bolster behind. In this exercise, you'll use 2 legs to push out, and it will be 0 to 45 degrees. Make sure you go into full extension and hold it in full extension for 2 seconds, and up to 45-degree flexion. The key when you're doing this one, you'll do 25 reps 4 times. Obviously, when you're initially taking it out, you'll need both legs. If you find it hard to do initially, you can always use your hands here to help push it out, like so, and then you'll do it one-legged. If you're feeling a bit nervous with one leg, you've got the other foot here as an emergency brake. So if it feels like you need some help, you can use the other leg, but it sits away from the plate, and it's the emergency brake. But again, make sure you go into that full extension. Set of 25, and you'll do this 4 times. If you've got a machine where you're pushing up in the gym, or even a machine where you're pushing the body and this part stays fixed, they're just as good. But remember, still go into that full extension. 45 degrees flexion. We can use a kettlebell for the other knee extension exercise. Putting yourself onto a surface that's well supported, and the knee shouldn't be here, it's too far away, it needs to be tucked right in. That will be 100 reps, 2 second hold, end of range. Small kettlebell from anywhere from 4, 6, 8 to 10 kg are really helpful. They can be purchased from Decathlon if you don't have them. 2 second hold. If you want to use your dining chair, it's fine, but just be wary of the fact that you really need to have the support right under the knee here. I'm sitting too far out here, it's not suitable. be better here to go into this position. And now I'm well supported here, 0 to 45 degrees, 100 reps. Notice here, 2-second hold. Okay, now the last set of exercises will be balance. A small ball, can be a basketball, it can also be just a tennis ball. Will also get you, this is a squishy rubber mat, or you can use a towel at home, whichever you have. These are your balance exercises. We find with balance, the old way of doing it on a wobble board, the reactionary way, has been out of favour for many years. You're better to do it on something like this. It's not quite as wobbly. And also, you need to aim at a particular end target. It's a better way of balancing. So if I'm practicing on my right, I can start with my toe slightly off the squishy mat or on a towel, and I'm going to go into forward flexion like so. Notice here, my knee starts at about 10 degrees flexion. It's not fully extended, 10 degrees off, and I'm bending from my hip through here. Additionally, notice when I do this, I'm not bending my back. My back stays nice and erect. If I bend from my back, from here I'll hurt my back. This is going to be 50 repetitions. The second exercise will be 50, 2, 3, 4, 5, 6, 7, 8, 9, 10, 50, and then 2 minutes. Passing the ball around my back. 2 little throws, 5 repetitions behind. And then under here like so, balancing on the bad leg, 5, and we'll do that for 2 minutes. So there's a really good exercise program for lower limb, especially for knee injuries, including balance. Happy exercising.